Mm.
Good morning, everybody. Good morning. Um,
Good morning.
good morning, everybody. Welcome. I want to welcome everybody to the FY26 federal block grant allocation plans that we will be having the pleasure of hearing from all of our agencies today, coming very soon. And we look forward to hearing from each one of them to talk about their proposed plans for, at least for this coming year temporarily, as long as we know that funding and everything stays in place where we are right now. We're going to start in a few minutes. I'm going to give a few more people a chance because I'm getting texts from people saying I'm coming, or I'm getting on. So I know we have a huge arena of legislators that are signing in or also participating. I want to thank everybody who can come to
Hi,
the.
Tony.
How you doing?
Just for
Uh,
the record, my friends,
yeah.
we haven't started recording yet, so these are just introductory remarks by Representative Walker, and I will let you know when we are ready to start. Okay?
Okay. So you want me to be quiet now, madam?
No, I'm not saying that. You can keep talking. I just need for everybody to understand for the record that we have not officially begun. But
Oh,
shortly.
okay. Yes, we are trying to give people as much time to get themselves situated and things because everybody has, I'm sure, either an opinion or wants to hear about what the agencies are going to be talking about. Let everybody know we're going to be talking to Department of Mental Health and Addiction Services, Department of Children and Families, Department of Public Health,
Got here.
uh,
A minute.
Department mute yourself, Kathy. Department of Social Services and Department of Public Health, and also the in the afternoon we will do the LIHEAP and CHEAP allocations. So I hope everybody's having a good summer. I am not there. I am still recovering from a little bit of an addition to my body. I got a new shoulder, so I'm doing good. It's just not all there yet. So I thank everybody for all your cards and well wishes. So. Senator Austin, are we ready?
Um, I think that we have a number of people that are here right now that are just starting to sign on. I am finally got my computer up and running. So I think that we're getting ready. Madam Administrator, are you all set up there? She's not quite ready yet,
Okay.
Tony, so we're going to give her a second. And I'm not quite ready yet either, so I am enjoying the fact that it's taking a little bit of time to getting us moving.
Yes.
All right.
Yes.
So,
There we
good
go.
morning, everybody. Hope everybody is well. We're going to start the public hearing for the FFY 26 HHS block grants broadly. We have a number of block grants today. I think we have 7 in total today, 6 this morning and 1 this afternoon. So, and I will say for the record, I love the fact that DOT is doing work on every highway I travel on. I love it. So I refuse to complain about the fact that that's where we are because, is what it is. Because it does take time to get the work done on the highways, and so I think that that's great. So let's see who we have here today. Representative Walker, do you have any opening remarks?
No, ma'am. I'm just doing a fill-in. I'm doing great
Okay,
now. Thank
thank you. I appreciate that. Representative Nuccio.
No, ma'am, I think Tony remarked for all of us.
you.
Senator Summers. No opening remarks there. Let's see, who else do we have here today? We have Senator Anwar, any opening comments?
Sure. Thank you, Madam Chair. Madam Chair, I just wanted to recognize the fact that for some reason we are having all of our meetings before September 6th. Not sure what's happening on September 6th. So
We have to have these done by the August 18th in order to be qualified for all block grants. So that's why we're doing this. It has nothing to do with September 6th or anything else. It has to do with the deadline that the federal government has for us to get these in. Exactly.
well, I thought it was because a lot of people are jumping out of airplanes on September 6th. So that was the reason.
Oh, you're talking about the fact that we're jumping out of an airplane on September 6th. Are you joining me?
I'm starting to feel bullied.
I will I will be there for landing reception team.
Yes, I see that. I haven't, this is my T-shirt right here. Woohoo.
Good.
Susan
Thank you.
can
Can I continue a few more remarks, Madam Chair?
Yes.
Madam Chair, I just wanted to recognize this is, I'm looking forward to an important and meaningful conversation this morning. The block grants have been here for decades, which have been very effective to help us take care of individuals who have mental health issues, substance related substance abuse and substance use related challenges, but as well as maternal and children's health. This is an interesting time. We look at HR1, and then there is conversation about some of the changes happening to some of these funding. We know that the states have had control over how we have used these funds. That has given us the understanding of what our needs are in our state, and then I'm hoping to have a conversation today to learn how much of those local control is going to be impacted. And I will listen to my colleagues as well in their questions and discussion, because local control is a very important word that's used in this building. And I'm hoping when it comes to the local control of the state, we will have the same passion when the federal government is making regulations, laws to take away the local control from our state. So I would be very interested to learn how people feel about that. I also am going to learn a little bit about the carryover funds, so to see what is happening, because the needs are increasing and we are probably not going to have too much of that going forward. That is going to restrict us. And finally, the gap analysis, because frankly, with the needs going up and the federal funding staying as it is or maybe decreasing, we will have to look at the gaps of services to our community, and we will have to figure out how do we take care of the people that we represent. So good conversation. Looking forward to it today. Thank you, Madam Chair.
Representative McCarthy-Vahey.
Thank you very much, Madam Chair. Thank you for this opportunity. I look forward to the conversation, to hearing from our agency partners, and to understanding how we're funding a piece of the needs. And I think that often happens here in our conversations, and we need to just make sure we have the context and understanding that this is a piece of what we fund. And I am also interested in how that conversation will shift and change going forward. But for today, look forward to hearing from those testifying and to the conversation with members. Thank you, Madam Chair.
Representative Claire DeStitria.
Madam Chair, if I may, I just would like to express her regrets. She is traveling. We'll try and log on as she is able, but she wanted me to express her regrets. She was able to join us earlier this week for the briefing. Thank you.
Thank you. Senator Summers, are you on? Yeah, I know you'll be on. Okay, Senator Lesser. I think Senator Lesser had an engagement that he could not get out of today, but he said he was going to try to log on. Representative Gilchrist? No. Representative Case?
Good morning, Madam Chair. Let's get rolling.
Senator Perillo? Oh, all righty. Let's start with, up first, we have Commissioner Navarrete and your budget director and others.
Good morning.
Good morning.
So greetings, honorable members of the Appropriations, Human Services, and Public Health Committees. I'm Nancy Navarrete. I'm Commissioner of the Department of Mental Health and Addiction Services. And I have my Chief of Government and Legislative Affairs with me, Kelly Cinco, up at the table, and my Budget Director is behind us. I'm here before you today to respectfully request your approval of 2 block grant allocation plans, the Substance Use Prevention, Treatment, and Recovery Services Block Grant and the Community Mental Health Services Block Grant, which we collaborate on with the Department of Children and Families. First, I'll begin with the Substance Use Block Grant. This block grant provides funds to states to develop effective alcohol, tobacco, and other drug use prevention, treatment, and recovery services. It should be noted that we are required to set aside at least 20% of the funds for what's called primary prevention strategies, which focus on preventing disease or injury before it even occurs. And we not only meet this requirement, but we exceeded at 26%. For most of the plan, the recommended allocations before you today remain mostly unchanged from last year. You have my submitted written testimony, and I want to bring your attention to a few items within the plan that have changed. Funding has been increased for recovery support services to do 2 things: support 3 areas previously funded by expiring federal sources, and provide one-time funding for a new initiative. The 3 programs include our DEMIS Access Line, call center, and transportation providers. So that is a 24/7 service for individuals that are looking for substance use treatment, connects them to care, and can transport them there as well. Integration of behavioral health services for survivors of domestic violence, that's through CCADV, and in 4 shelters across the state, it would embed clinical care. And SOAR is an outreach and case management service, which assists individuals with a substance use disorder that are unhoused or at risk of homelessness, and it helps them access entitlements. The new initiative is an important step in supporting our peer recovery workforce. We use funding from this block grant, as well as the Community Mental Health Services block grant, to fund the development, piloting, and implementation of a peer credentialing exam for individuals interested in becoming a peer supporter. Any other changes to allocations between 25 and 26 do not reflect a change in access or level of service provided. Most of these small discrepancies are due to timing of payments. Because they're invoice-based, we receive invoices from our providers and then pay as a result of that, and sometimes it crosses a fiscal year. And then that it looks like an increase or a decrease, and it is not. Please also note that DEMIS is retaining a larger carry forward in 26 compared to previous years to prepare for the end of various federal grants that were received during the pandemic or other changes that may happen in the federal funding. My team, along with our partners at OPM, are assessing how those funds may be used to promote continuity in service delivery if we need to. In closing, these funds are instrumental in helping provide a range of substance use treatment and recovery supports to meet clients' needs, including not only residential withdrawal management, which people know as detox, intensive, intermediate, and long-term residential care, outpatient treatment, medication-assisted treatment, also peer community support services like case management, vocational support, transportation, and outreach. As I noted earlier, these funds are also used on prevention and health promotion services and can be focused on individuals that are not currently in need of treatment and help preclude substance use through targeted based on whether someone is a member of the general public or in a high-risk environment or have certain characteristics that make them at risk for developing a substance use disorder. Before I continue with the Mental Health Services Block Grant, I'm happy to pause here for questions, or I can continue.
I would prefer that you go through, so we're asking questions all together on your
Sure.
particular issues.
So I will be joined by my colleague, Dr. Nicole Taylor, after I give my testimony from the Department of Children and Families, and she'll speak to the child portion.
And I'll call her up afterwards and we'll ask questions of, we'll try to ask questions of the respective agencies, and you can say those questions are more appropriate with the agency that will be coming up after that. So.
Okay. So to recap from my introduction, we're here to respectfully request your approval for the Community Mental Health Services Block Grant Allocation Plan, which we collaborate with DCF on, as I mentioned. This block grant funds mental health services for adults with serious mental illness, also known as SMI, and a portion is shared with DCF to provide services for children with serious emotional disturbance. You have my submitted written testimony, and I'll provide an overview of the highlights of the adult portion of the plan before turning it over to DCF. So first, it's important to note that this block grant only represents a small portion of DMIS's spending on the mental health service system. The block grant is intended to address emerging mental health needs and to supplement state funding for various levels of care, like emergency crisis services, outpatient clinical services, residential, employment support services, case management, and social rehabilitation. Like the other SU, substance use block grant I spoke about, the recommended allocations before you today remain mostly unchanged from last year with a few notable increases. There are 4 line items in particular that I will draw your attention to. Funding for the Regional Behavioral Health Action Organizations, that you know as RBHAOs, is increased to provide ongoing support to the state's regional suicide advisory boards. And this enables a local response to suicide prevention. Funding for case management is increased to ensure continuity of housing outreach and support programs, including SOAR, which I spoke about on the substance use side, as well as the Connecticut Transit Homeless Outreach Program, which we call THOP, which is a very successful partnership with DOT, Department of Transportation, and DESP, Emergency Services and Public Protection, to engage individuals that are on the Connecticut Rail or fast track stations. As I spoke about in testimony on the substance use block grant, we are also using mental health dollars to support the peer workforce and peer credentialing to further recognize the contribution peers make to recovery-oriented care. And so we split, because this is integrated services, we split half of the funding on the substance side and half on the mental health side. Finally, the increase to the emergency crisis response and prevention line supports an annualization of funding for a crisis respite program initiated in April 25. Any other changes you see between 25 and 26 do not reflect reduction in services, but again, is the timing of invoices and payment across fiscal years. I also wanted to note DMIS's intent to prepare for the end of various federal grants that were received during the pandemic or other changes in federal funding through the retention of a larger carry forward than previous years. My team, along with our partners at OPM, will continue to closely monitor federal action and, if needed, assess how to carry forward to promote continuity of services. Before I end, I also want to note for the record that our testimony includes a request for a technical correction on page 13 to Table A. The total in federal fiscal year 26 proposed expenditures did not accurately reflect the sum of the 2 lines above it. It's a summing error. This does not impact any other component of the block grant. In closing, the funding in this block grant provides it's extremely important to community-based providers across the state as they work to support our shared mission of developing community-oriented, cost-effective services that allow individuals to be served in the least restrictive and most appropriate setting available. So that concludes my testimony, and I'm happy to take questions before turning it over to DCF.
Thank you very much, Commissioner. And just so everybody realizes, because of the technical correction on the summing error, we have to make sure that we mention that. So each one of the chairs have how we're going to state when we're voting on this grant. We have to include that in there. So make sure that when you're doing that, that we're including that. That's a technical correction, so that when we're voting on it, that we know that why we're doing that, but that has to be mentioned. Are there any questions about the block grant? Let's stay focused on the block grant. And it's need to be passed by the 18th in order to get our marker in that we want this done. So we have a number of people that have questions. Representative, okay, we'll start with the chairs. Representative Walker, do you have any questions?
Thank you, Madam Chair, and thank you, Commissioner, for your presentation. My only question really is, of the three items, the access line, the integration for domestic violence, and SOAR, are any of these items funded in the opioid settlement fund?
No.
No, okay. Are any of the changes that you are addressing or any of the shortfalls in this block grant, are any of those being funded in the opioid settlement fund?
There are really no shortfalls other than an invoicing issue.
Okay,
And the one program that had 27 people enrolled for a total of a year.
and the
That was-
mobile, that was the mobile unit?
Yes, yes.
Okay, so we're not moving that expense into the opioid settlement because that would be supplanting, and I just want to make sure we're careful on that, correct?
Correct. So that was a mobile service to induct and maintain people on buprenorphine.
Mhm.
Through the reception program, which closed. It served 27 people over the course of a year. So at the point in time that it closed, it was obviously a smaller number than that. We were able to transition folks to the provider of their choice in that area, which could have been USI, CHR, or the Root Center. And so we did not reprocure that.
Thank you, Commissioner, because that would be something that we would have a tremendous problem with, and we want to make sure we are doing exactly what we're doing with the appropriate monies that we have. Thank you, Madam Chair, Kathy.
Thank you. Representative Nuccio.
Thank you, Madam Chair, and thank you, Commissioner, for your testimony. I have a couple of just quick questions. Clarification, just for my notes, did you say that we are receiving an increase in the funds and the block grant from the federal perspective, or?
No, our plan is always historically and this year as well, based on what we receive in the current
Prior,
year.
yeah.
And so that's what we plan against. We would not know what that final number is for quite some time.
Okay, that's what I thought. And then in regard to, in general, with all of these, you had mentioned, the going away of the pandemic funds,
Mhm.
right? And I know we've set up here 1,000,002 times, everybody knows their one-time funding and that. Have you looked at the programs that you are proposing to keep with those funds in comparison to the programs that we have? Are there any efficiencies, anything? I know last time we went over these, some of these grants, there's a lot of dollars involved in, I think at one point, I'm trying to go back through my notes, we had like 7 people, like you just said, the mobile one, it was like 27 people.
And that was not funded by ARPA.
Well, no, but I mean, in general, if we're using dollars, if
Oh, yeah.
it's, a few $100,000 to help 27 people, and then we have a program that was funded through ARPA dollars that we knew and know are going away, that has a higher efficiency rate. Are we looking to kind of balance within the block grant dollars that we have to select the programs that are most efficient and are helping the most amount of people?
Correct. We have, there are several ways that we monitor that. So not only do we have in-person monitoring where we have clinical folks going out to our contractors to review documentation and services provided and speak with clients directly. We also have a front-facing report card of sorts so that the general public, legislators, anyone, the provider themselves can look on that public-facing report card to see how they're doing. And we also regularly run reports within our quality and evaluation department at DMIS to see if there are any outliers. So let's say something pops up where, oh, this program hasn't had any emissions for 6 months. Is that a data quality error, or is that a service provision error, or shortfalling? And that's how we would follow up with individual providers.
Okay, so you are basically looking for the most efficiency. And are we looking at also the providers? We have some concerns now at a federal level with certain nonprofits and that. Are we making sure that the programs that we're utilizing are being utilized correctly? with the adequate funding and making sure that everything is on the up and up with that. My last question is in regard to, you had mentioned specifically spending a portion of this money for, I'm sorry, I wrote it down here, peer credentialing and funding like a program for peer credentialing. Do you know how much we're allocating to something like that in terms, in comparison to what we are doing for actual therapists, right? I understand there's a really big push for peer counseling, but I'm definitely more focused on how we get people the therapy and the help that they need with especially these issues. So I'd like to just understand the balance between what we're allocating for helping people become a peer person rather than an actual documented, whether it's therapist or social worker.
Sure. So this particular expense is $50,000 across both block grants, so about 25,000 on each. So this is not about hiring individuals, it's about establishing a standard of care so that should an employer want to hire somebody, they know that this person has met certain benchmarks and done certain things in their training to qualify for the exam and pass the exam.
Okay, I appreciate that because I would want to make sure that the people, anybody can say they're a peer counselor, but I would like we have some rigorous supports around it that we're actually saying there are requirements and you have to have certain educational components to be able to interact and help people. So thank you very much.
You're welcome.
Senator Anwar.
Thank you, Madam Chair. Thank you, Commissioner, for your testimony. Commissioner, my first question is that I'm looking at the carry forward of 27.4%. And on the other side, I'm also hearing from peer respite groups and peer support groups that some of them have not been paid. There was a hope to be expanding them. And I'm trying to connect the two and see that the money has not been used. Is there an opportunity, or was there an opportunity that was lost in addressing that, in your opinion?
No, I don't think so. Everyone has been paid to my knowledge. We haven't not paid somebody or a
Okay.
provider.
So maybe offline I can follow up with you.
Absolutely. Yeah, sure. And if you look at the total spend, it's $20 million on the substance use side and 7.4 on the mental health side. The actual grant itself is 20.4 million on substance use side. So you can see we're very much in line with what is available on an annualized basis. And the same thing on mental health. The total expenditures are 7.4 million. The amount available for the block grant based on this year's allocation is 7.1. So we're very on par with our annualized amount. The carry forward, it would behoove us not to overspend given what the landscape is and not knowing what the future holds. These could be dollars that would help us potentially off-ramp something or take something on for a short period of time while we figure it out.
Sure. Madam Chair, as my second question I wanted to ask was, with this carry forward, some of that is part of the block grant and some of it is not part of the block grant.
No,
Is that
that's
it's all
not
part of the
correct.
block grant?
Yes.
Okay, because I was worried because there was a mention of some specific funding around the pandemic, because some of that has to go back, but the block grant money can be carried forwarded for the next plan. So all of this can be used going forward if, God forbid, there's a reduction of any support of any kind.
Yes, you have to spend the allocation within 2 years.
Yeah. Okay, thank you so much. Thank you, Madam Chair.
Representative Dillon.
Thank you, Madam Chair. Good morning, Commissioner. And I regret that I'm not there in person. I wonder, from my first question, there were changes, as my understanding on the federal level, to the suicide hotline that could have the effect of reducing access to LGBTQ populations. And in the document before us, when we're looking at the work that you're doing with the regional suicide advisory boards, I wonder if the department has contemplated any changes to our existing protocols to make sure that that access to that group of people is maintained.
We will continue to serve everyone that calls the line. It was what the federal government changed was an option. I want to say it was option 3, but they changed the availability of that option. Those calls continue to come through at the state level, and we will accept and triage all of those calls and make sure that our counselors that are answering the phone have that capability to handle whoever is calling in.
Thank you very much, Madam Commissioner. And for my second question, which might be more complicated, but because it's future oriented, for the capacity of our providers and the department, as I understand it, the big, beautiful bill, whatever, proposes a dramatic reduction in indirect costs reimbursement. And I think that may still be under negotiation, but I wonder if your department or working with OPM has evaluated the effect.
We're not going to talk about that bill right now, Representative Dillon. We're just talking about the block grants because OPM is going to be releasing a report on that bill, which will be coming to appropriations sometime in the next week or so, I believe I saw that pass. So it's not really impacting the block grant per se.
Thank you, Madam Chair, but my question was about indirect costs, and so I just want to leave that there because there could be a radical impact on some of our providers and their ability to provide service. So
Relative to the block grant, ma'am?
Pardon me?
Just to make sure that we're staying focused on the block grant.
I appreciate that, and thank you very much, and thank you, Commissioner.
Thank you. Representative Dathan?
Thank you very much, Madam Chair, and thank you, Commissioner, for your presentation today. This was really helpful. As you know, I'm very interested in the peer support services, and I saw that you have increased the block grant allocation to 10 million, which is great for some new peer support services. I just wanted to ask, why are we not using the SAMHSA guidelines, the training and the support and certification that they do, and why are we developing our own services?
Well, it may be a million.
It's actually $50,000 across the 2 block grants that we're spending on this particular initiative. We have done a lot of research on this across the nation, and we are integrating the competencies that are put forth by SAMHSA into what we would expect people to know. So we didn't recreate the wheel. We incorporated what is out there as a national benchmark.
So is it pretty easy for someone who has that SAMHSA accreditation from maybe another state or within Connecticut to receive that credentialing from you, or do they have to pay additional amounts? I'm kind of confused what we're
I can
doing
certainly
with
have
it.
an offline conversation with you about the whole process, but we are allowing for a grandfathering process where people, if you hold a credential now, we want to encourage people to get the credential. This is not to put up barriers so people cannot get the credential. So we would grandfather everyone in. We would set a date moving forward that people would then take the test. We're actually asking for volunteers to take the exam, the pilot exam, so that we can make sure it is reliable and valid. That's part of the whole developing a test process. So there'll be plenty of time for anyone who holds a credential now to be grandparented in.
Okay. And then if you could supply the administrator with kind of the allocation of the recovery support services, that 10 million, if you could provide a breakdown at a later time to see where that money is kind of going between you said the 25,000 for the accreditation, but I'm assuming that some of those others are going to actual agencies. So if you could share that offline, I'd greatly appreciate it.
I think we already have it.
Oh, I didn't see it in the presentation and maybe I missed it.
It's in the OFA analysis.
Okay. Yeah, if you have a question, I will come back and ask then, because I was focusing on your presentation and your slide deck. But thank you so much.
5 of the OFA analysis.
Okay, I'll have a look and then I'll follow up with any questions. But thank you so much again, and thank you, Madam Chair.
Thank you. Representative Corpus?
Thank you, Madam Chair, and thank you, Commissioner. Lower my hand. I have 2 questions. I just wanted a little bit of context for the community mental health area and the substance use area. What % of the total spending in those areas do these block grants comprise? I just have no sense of that.
Well, our entire budget is close to $1 million. So it's a very small percent. What did it say? Did I say them? Oh, I said $1 million. $1 billion, I'm sorry. $1 billion. And so that part of that 92 million is federal dollars. Close to 800 million is state dollars, and some of it is related to DISH.
Okay, thank you. And that's taking CMH and substance use in the aggregate.
Correct.
Okay, thank you. And second question is, do the block grants come with any requirements to measure efficacy or outcomes? And or do we as a state, how do we as a state measure our success in the $1 billion that we spend in this area? I would imagine that each program is measured in its own specific way. Where is that information and how could we see that?
So it is part of the application itself. If you look at the full application, there are outcome measures included for each type of service. And there are benchmarks there that we set for ourselves that we have to meet.
And on the rest of the budget, the 92 million is federal block grants and the whole $1 billion, the rest of the budget, do we as a state use those outcomes for everything?
Yes, we do. And I'm going to interrupt because I'm trying to stay directly focused on the block grant. And this question came up during the briefing, and all agencies are providing us with how they measure outcomes broadly in their agencies relative to their respective mission. So once we get all of that, we'll send it out to everybody.
Thank you.
Representative Ackert?
Thank you, Madam Chair. Commissioner, appreciate the opportunity to ask a couple of questions. I'm just looking at the table A, and now hearing about your total budget, this seems minuscule now that I asked this. But I did see that you did explain the reduction of the community treatment services of the substance abuse prevention treatment recovery table A. It's like 1.5%. And what you did clarify that reduction is a provider closed or shut down.
Mm-hmm.
And
Yep.
in that it mentions in the brief that some community group picked it up in the region. And so is it a local group, and what region are we speaking of?
Sure. So this was a provider. This is a total of $35,000.
Okay.
So this is a provider in Willimantic, a substance use provider. It was a total of, as I mentioned, 27 people served in a year for this particular service. So it was not a big lift for us to be able to match individuals with their choice of provider in that area. There are 3 in that area: the Root Center, CHR, and USI.
Yeah, that's my area. That's why I'm
Yeah.
asking the question. So that's the district I serve next to Representative Johnson. So appreciate that. And then there was just a shift. It looks like or a reduction here. Again, it's the children's mental health services, a reduction about 6%. And there wasn't a reason why on that one.
I will let Dr. Taylor speak to the DCF side.
Thank you.
Thank you. Are there any Representative Meskers?
Thank you, Madam Chair. Just echoing the comments from Representative Jason, I'd like to follow up offline at some point related to certification and any of the changes in the providers and the requirements for state certification. I'm concerned that we, are able to enter compacts and have reciprocity on treatment to make sure we have the maximum amount of treatment. I'm in a border area, so I'd be particularly concerned that we would impact access to treatment with barriers to entry for certification on the services. So at some point, I'd like to talk about that. I apologize, Senator Austin. I know we're supposed to keep to the appropriation, but I appreciate it.
Thank you, sir. Are there any other questions for Commissioner Navarrete? I see none right now. Ma'am, you're all set. If you could
Thank you.
stay in case something else comes up. And
Sure.
up next we have Dr. Taylor. I think I called her Commissioner last time. She was on the call with Stephanie Bozak. So I think the two of you are up next.
Thank you. Good morning.
Good morning.
Good morning, distinguished members of Appropriation, Public Health, and Human Service Committee. My name is Nicole Taylor. I am the Chief Admin for Behavioral Health and Wellbeing at the Department of Children and Family in the Commissioner's Office. I am joined this morning by Dr. Stephanie Bozak, our Behavioral Health Clinical Manager in the Behavioral Health Community Service Division at DCF. Thank you for the opportunity to present the department's proposed federal fiscal year 26 allocation plan for the children portion of the Community Mental Health Service Block Grant. A written testimony has been submitted, and so I will highlight some of the changes of our proposed this year. DCF proposes to allocate $3,225,000 from fiscal year 26 CMHS block grant, which is inclusive of $187,244 in available prior year carryover funds. This is less than our previous year carryover funds. I would like to highlight the 8 funding changes that have occurred with fiscal year 26 in comparison to fiscal year 25. First is the Youth Service Prevention Mental Health Promotion. Funding has a reduction of $12,500. This modest adjustment would mostly impact our support of a conference. The This service continues to support suicide prevention efforts across the state, including evidence-based suicide prevention training and practice. In addition to the support for the conference, there is training that is also being offered from other services. Specifically, DCF also offers this service in our training academy. And so this modest decrease will not impact overall service as well as training. The Connecticut Community Kids Care Workforce Development has a reduction of $25,000 compared to prior year. The program prior projects have been completed, and so additional funding, the current proposed funding will continue with service without any true reduction in service. Specifically, there was a training on a class that has been completed, and so the reduction reflects that. The extended day treatment has a modest reduction of $2,500. And this is just a reduction due to the actual cost of the program. So again, funding will continue to sustain all of the services that focus on statewide standardized multifaceted model of care to provide behavioral health treatment and rehabilitation services to children and adolescents. Our first episode, psychosis, there is a 10% set aside for this services. last year, we were able to allocate additional funds for a project that has ended. So now there is a reduction of $167,000. All of the $305,000 will be used towards the first episode psychosis learning collaborative in partnership with DEMAS for the Yale STEP and clinical high risk psychosis program. So again, there will be an increase in the services that Yale provide, and our prior service that has completed, the funding from there will go towards Yale. Our outpatient system and treatment improvement has a reduction of 50,000. This training goes towards the
Excuse me, Dr. Taylor. The OFA analysis that we have is different than the numbers that you have in front of you. And I think a lot of people are referencing the OFA analysis, which is significantly different than what you're saying. So
My apologies. Let me just see if I can.
I just want to make sure that we're not confusing people, and I am trying to make sure that the questions are germane to what you have. So on page 5 is the Community Mental Health Services Block Grant for the OFA analysis. And the numbers, you just said, for example, that there was on the outpatient services, you said there was a $60,000 decrease, and we have 38,476. Each one of these is just different than what you have, and so I want to make sure that those differences get addressed. And maybe we need to sort of step aside and address those differences in a later format. I'm not certain, and I don't know if perhaps Mr. Ayers, if you can sort of explain to us what the difference is between these two in OFA and what she has down as her. Okay, all right. So
My apologies. Stephanie, why don't you explain the differences between our
thank you.
numbers?
I appreciate it. You don't need to apologize. I can foresee questions happening, and I want to make sure we are understanding it.
Sure. Thank you for the question. Can you hear me okay?
Yes.
Thank
And
you.
you need to introduce yourself too.
Thank you. Stephanie Bozak with DCF. I'm a behavioral health clinical manager. And so I think the discrepancy that we're talking about when looking at page 5 of the fiscal analysis is due to the invoicing. So as Commissioner Navarrete had indicated, there sometimes is a difference between when we receive invoices and so when that's billed on the actual expenditure. But what we are talking about is what we are proposing as the allocation moving forward. So that's why there's a bit of a discrepancy.
Okay, I want to make sure that people understand that, because I'm looking at the numbers, you're saying one thing, I'm seeing another thing, and I am hearing chatter up here on the differences, so.
So it appears as if the differences here are a little bit more, but what we're talking about is our allocation from last year compared to our allocation this year and the differences between those two, rather than the
Than the OFA analysis. Thank you, Doctor. If you wouldn't mind continuing, I apologize for interrupting your flow.
No problem at all. Thank you. So I think I was discussing the outpatient system and treatment improvement. And so our proposed allocation for this here is 283,000, which represents a reduction of $50,333 from last year's allocation. And this goes towards training and oversight of evidence-based treatment model in the outpatient care. There is a particular training that will be ending this year, and so that reflects the change in our allocation. Okay. The quality care and best promotion, our proposed allocation was 227,500. This This represents a reduction of 97,500. So the proposed allocation will continue to support the activities related to the implementation of the Connecticut Behavioral Health Plan, implementation activities of the advisory board charged with overseeing that plan. Some of the activities include a reduction that will impact training. However, that will be addressed with a different grant, with the Connect System of Care grant. So the overall activity doesn't change. It's just the payment of that activity changes. And then the Connecticut Community Kids Care, which our proposed allocation is 25,000. This reflects a reduction of 20,000, and this adjustment is actually in line of what the actual program cost. So there will be no impact to the activities of this program. And then finally, the emergency crisis, which our proposed allocation is 675,000 with a proposed reduction of 125,000 from prior year. This reflects a reduction in training for community helpers, but that training is actually offered by other entities, again, including DCF Academy. So the activities will continue, just the funding source will be different.
All set, Doctor?
Yes.
Thank you
Thank
very
you.
much. Are there any questions for Dr. Taylor? Okay, let's see. Representative Walker, do you have any questions? Representative Nuccio?
Thank you, Madam Chair. So I only have one question, just because the numbers are just so different. What is your total change year over year?
So for fiscal year 25,
Prior year to what we're doing right now?
Okay.
Yes.
so our estimated for fiscal year 25 was 3,600. I'm sorry, 3,600 and 2,255.
And the change, like what is the net change from
The net
25
change
to
was
your plan for 26?
the net change was a 13% change.
So,
Increase or
excuse me. Neil,
Mm-hmm.
we're not getting anywhere near the same numbers at all. Is there any way that we can take a break from this one and have you and Dr. Taylor talk about this? Because
they're drastically different.
I can't make any sense over these numbers at all. I show a 5.8% difference year over year. And she's talking a 13% difference, and it's not, I just can't get this done.
We can certainly take a look at it. I believe the crux of the difference is comparing this year's proposal. One of us is comparing it versus last year's actuals. One of us is comparing it versus last year's proposed.
Okay.
I think that's the.
So I'm gonna take a Dr. Taylor, if you don't mind. And before we ask any other questions, we're gonna take a recess for 10 minutes to have Dr. Taylor talking with Director Ayers, and we've got to come up with what happened here, because I agree with you, that's probably what it is, but I can't do that online. So Madam Administrator, we're going to take a 10-minute break and have them talk, and then we can come back to what we have going on here.
Yeah, no, it's been a long time too.
Phone by scanning the QR code on posted signs before you leave. To expedite exit, pay with your phone by scanning the QR code on posted signs before you leave.
So we're going to bring everybody back to order. And before we go any further, there's been some changes to the setup in room 2C that you should all recognize. And it's been something that the administrator and the Office of Legislative Management have been working on. And some of the chairs out there have been removed in order to make this a more ADA accessible area. It's not done by any stretch of the imagination, but during our public hearings, we would have people come in wheelchairs and they could not navigate around. So some of the chairs have been removed in order to make the area more accessible. And I certainly applaud OLM and the administrator for looking at it, making decisions. And I think that that's something that you all may be able to pass on to constituents who come here. And we are working very hard to make sure that the area is more accessible. You all know we have translator interpreters now, not just for different languages, but also for the deaf and hard of hearing and the deaf-blind community. These are things that we're looking at all the time. We're also trying to address the desks so that people can get up and testify in our very complicated audio system here. So I just wanted to sort of put that out there. And so we're going to come back to order, and we're going to start with Dr. Taylor and Director Ayers. The floor is yours, guys.
Okay, I think this is a situation where both sets of numbers are correct. They're just comparing slightly different things. The OFA analysis is looking at this year's proposed block grant plan as compared to last year's estimated expenditures. I believe the agency is comparing this year's block grant plan versus last year's proposed block grant plan. I believe Dr. Taylor can probably speak in more details.
Dr. Taylor?
Thank you. That's correct. So for last year's estimated expenditures compared to this year proposed, there's a 5.8% decrease. As we review our proposal, we looked at some of the programs that had underspent, and some of the cuts were really we use some of the cuts on those programs that are underspent. So I was comparing our proposal compared to our proposed last year and not to what they actually spent last year. Of course, we haven't closed out all of our contracts yet, so it's difficult to tell exactly how much is going to be used, which is why I was using the proposal. The other thing to note too is that our carryover this year is significantly less than it was to 2025.
And that would be determined based on what is actually left to be carried forward,
Right.
correct?
So we're estimating 300,000, about 300,000 carryover to fiscal year 26 in comparison to, I think, 1.1 million from 24 to 25. So that 13% reduction that I mentioned was the total amount. Our block grant, we're assuming to be a flat funding, but the carryover is really where the reduction occurred.
So we want to make sure that you understand that we're actually asking questions on the data that we see in front of us. And so when we see two different sets of numbers, we're going to ask why. Because we have the one, we're asking questions so the public can get the reason why the differences would be there. And we want you to know that we actually do read what you all send to us, and we're following along saying, this doesn't add up, what are we doing? So I just wanted you to know that we are actually paying attention to this, and I appreciate the explanation. And when you talk about underspent groups, they underspent because they didn't need to spend the larger dollar amount that was proposed, or would it be that ultimately the proposed application was decreased?
I think they didn't need to spend the amount, right?
Do you understand what I'm asking?
I do. I
Okay.
just want Stephanie to provide some clarification.
Can you repeat that question? I apologize.
Yep. So you had a proposal that went in last year for the application. Did you receive less funding in the final application that was given to you? Or did the vendors not need the dollars that were available to them?
The total block grant that we were given last year was actually a slight increase than what we had previously anticipated.
A slight what?
Increase.
Okay.
So what we had found was that our vendors, our contractors, not all of them expended the entire amount, but some of that is due to the invoicing.
Okay.
Another piece of that, however, is some of the contracts, we did look at what was actually spent and where projects have ended as well.
Okay, so you might have had a one-time expenditure or a program that that ended and is not included in the upcoming allocation request. So there was that piece of it, and some of it, probably a smaller piece of that would be invoicing year over year. So in the 24-25, you might have received more of the invoice in the 25 time rather than the 24 time. And so we're seeing a decrease this year, but it's reflective of the fact that the invoices came in 25 and you're not anticipating that increase following through to 26. Okay, thank you. So I'm going to go back to Representative Nuccio and start this sort of all over again. Representative Nuccio.
Thank you, Madam Chair, and thank you for that clarification. Neil knows I read everything, so that's definitely, that's part of my looking at this. It just wasn't lining up. So I appreciate the information on that. And I just really want to clarify, if I heard you correctly, any of the reductions that we're seeing here were mainly driven by either training that had occurred that we're not repeating, or programs that are offered elsewhere under other grants. So with those reductions, I'm assuming those dollars that we have here, it looks like they're definitely reallocated to other sections. The only one that I had a question on, and I believe you said for crisis, the emergency crisis, that was, again, it was a program or training that was offered someplace else. So we're not going to see any reduction in service in any of these. It's just a matter of how it's being allocated across the way, correct?
Yes, so with the training that she spoke of, that specific line item goes to our RBHAOs, where we support the RSABs in collaboration with DEMIS. A lot of those trainings that they do is inclusive of training that is also available widely in the community already. And so we did look at what was available elsewhere and where can we have the most minimal impact when we cut some of the funding because of the less carryover that we have from previous years. So when we looked across what we have to offer and what is offered elsewhere through either DCF Academy, like Dr. Taylor said, or other things that are available in the community, that's where we looked at and tried to make our adjustments.
I appreciate that. And I don't think you'll have an answer to this right now, but if you could get back to Madam Administrator with it, I'd be really interested to see of the 3.2 million. See, I do it too. I'm an accountant and I screw it up all the time. So 3.2 million here. How much of these dollars are actually used for administrative programs rather than direct care for people? And I don't think you'll have that now, which so I appreciate that. But if you can get that information over to Madam Administrator, I'd really like to understand the detail of that. Thank you.
Representative Comey.
Thank you so much to both of you, and thank you, Dr. Taylor, for the presentation and clarifying the numbers for us. I was wondering, Representative Nuccio asked the professional development question that I wanted to ask. So my question would be, there seems to be a lot of spend last year that were carry forward funds. Can you, where was that? That money was carried forward from this grant? And then do you expect it to be, further, do we continue to do this each year, is carry forward these significant amounts of funding and then continue to reduce it? I'm just, can you explain that to me? Thank you. Both of you. I'm sorry. Looking eye contact.
Thank you for the question. Yes. So in the past years, there was some carryover that we had utilized to pick up additional programs that were previously funded by other dollars. So for example, one of the programs that was picked up last year's allocation is the Urban Trauma Initiative, because that was previously funded by ARPA dollars. So when we looked at that, we started to actually use more of our carry forward. So you can see that from last year's allocation to this year's allocation, our carryover is significantly less. We would like, as much as possible, to build that back up as a contingency. But as of right now, we wanted to balance what we were able to carry forward moving forward, as well as making the cuts as minimal as possible for this year.
Okay, thank you.
Senator Anwar.
Thank you, Madam Chair. Thank you, Dr. Coleman, for the testimony and the work that you and the entire department does. I wanted a little clarification, and this is more also to make sure that the families who are listening to this would be able to understand if they look into the fact that the emergency crisis, there's a reduction of 6.9%. And then for families who use this will be a panic. So if you can expand to the fact that this is not going to impact the program in any shape or form, if you can clarify that, please.
I can start. Thank you for the question, Senator. Yes, as I stated before, that this funding does, the reduction is towards the training that as Dr. Bozak mentioned, that there are training activities that we realized were being done by other entities within the community as well as internally to DCF. So the mobile crisis support from our primary budget as well as this block grant will continue. So there would be no interruption within the emergency crisis support. However, this particular training that we felt could be given and is being given by other entities as well as by DCF, we felt that reduction wouldn't cause an impact.
Thank you. And my second question, just wanted to ask, the dashboard expansion is one of the parts. Could you expand a little bit about what that 50,000 would be able to help us achieve?
That goes towards our data system, which is where we collect all of the data to ensure that we are monitoring our programs, but there's also reporting requirements as part of this grant. So that funding goes towards the activities that would support that.
Thank you so much. Thank you, Madam Chair.
And just so everybody knows, just because there's a 2-question limit doesn't mean you have to ask 2 questions. You could ask only one. It would be okay. Representative McCarthy Vahey.
Thank you very much, Madam Chair. I do have only one question, and that is also along the same lines as both Representative Nuccio and Senator Amor had asked. And the emergency crisis dollars, the funding that you were providing to the regional suicide advisory boards, I'm assuming that QPR may be part of that funding. And I'm wondering if you could talk specifically about which trainings it is. And you mentioned that these are also offered through the DCF Academy and others in the community. And as someone who has worked extensively with our regional suicide advisory boards and our regional behavioral health action organizations, I know how often those QPR trainings are deployed in the community. And I'm concerned that, you know, it's different audiences, right? The DCF Training Academy. And so one, what other programs are being impacted aside from QPR? And specifically, two, who are some of the other community organizations who will be providing this? Because this is it's a concern to lose the access to some of these funds.
Sure. So our QPR is one of those trainings that we talked about that the RSABs do provide, and the DCF Academy does provide that. The other entity that does that is our contract that we have with a provider that does a lot of train the trainers. So our hope is that we can supplement some of the trainings by doing train the trainer trainings while really making sure that the impact is minimal in the community. When we looked at our crisis services, we tried really hard to ensure that the direct services were not impacted. And so the trainings that the RSABs do are really for the community helpers, not necessarily clinicians or direct services. So we're trying to ensure that those direct services are not impacted, but some of the other ancillary programs.
Okay, I appreciate that. And just for all who don't know, QPR is question, persuade, and refer. It is the equivalent to CPR for suicide prevention. And it's a training that's available and easy to access for everyone, something that we try and get out to everyone in the community. So I appreciate the delineation in terms of the work with clinicians as opposed to the community. I still, you know, share the concern, but I understand the decision-making process and appreciate the answer. Thank you, Madam Chair.
Thank you. Are there any other comments or questions? Yes.
Thank you for being here today. And I just have one question having to do with the early serious mental illness and the first episode psychosis. It seems that there's going to be a shift that their funding is going to be directed to the Yale program. And I just wanted to know what will that dollar amount be, and will it continue into the future as part of this grant?
So the grant does require a 5% set aside, or 10%, sorry, 10% set aside for that work. Previously, DCF had allocated a dollar amount that was higher than that percentage to 2 different contractors that we had worked with. One of the contractors had a program that we eventually sort of in evaluating it found that it wasn't directly impacting this early serious mental illness, FEP, first episode psychosis population, because it was identifying clients a little after what's considered first episode. And so that program is sunsetting. And what we are doing is working collaboratively with DEMIS to ensure that we are supporting the program because we found that the Learning Collaborative and the STEP that we have at Yale is really best practice and wanting to support that. So the entire dollar amount is going to be that 10%, so $305,217 that DCF is putting towards that, and then of course DEMIS as well.
Well, thank you.
Are there any other comments or questions? Thank you, Representative Reddington Hughes. Seeing none, you're all set, Dr. Taylor. If you could just stay around in case we have other questions. Up next is Commissioner Giuttani and team. And let's see how we do with this agency. Thank you, Commissioner. The floor is yours.
Good morning, esteemed members of the Appropriations, Public Health, and Human Services Committee. Thank you for the opportunity to testify before you today on behalf of the Department of Public Health. I'm Dr. Manisha Giuttani. I'm accompanied by Deputy Commissioner Lita Orofici and Chief Operating Officer Nick Jakubowski. And we're here today to discuss the proposed federal fiscal year 2026 allocation plans for the Preventative Health and Health Services Block Grant and the Maternal and Child Health Services Block Grants. If acceptable to you, I'll go through the presentation of both block grants and then.
Please do.
Thank you. So to start with the Preventative Health and Health Services Block Grant. As an overview, this block grant allows grantees the flexibility to use funds to address emerging health issues and fill funding gaps in programs that focus on the leading preventable risk factors for injury and chronic conditions. The proposed funding for federal fiscal year 2026 is an estimate based on FY25 at flat funding of $2.4,090,341. This includes a mandated set aside of $75,278 to provide crisis services to sexual assault victims. These funds are used to support chronic disease prevention work in areas regarding asthma, cancer, cardiovascular disease, diabetes, smoking cessation, injury prevention, suicide prevention, and sexual assault crisis programs. And almost half of the funding goes in grants and contracts to our local health departments to implement chronic disease prevention activities locally in the community. We have 18 different health departments that have contracts and have been doing this work. In addition, funding is used to help support our Office of Policy and Strategic Initiatives. This is the group that also works on strategic planning, accreditation, which we were able to achieve reaccreditation as a public health department this past year, and performance management and evaluation. Part of our funding is looking to evaluate exactly how the programs that are funded through this grant have been doing, and that is part of what this office works on. The second block grant that I'd like to discuss is the Maternal and Child Health Block Grant. This block grant supports a variety of services that address critical maternal and child health needs. And these funds are used to help ensure that high-risk pregnant women, children, and families across Connecticut receive essential services such as care coordination, screenings, and community-based supports. The allocation plan is also flat funding from FY25 to FY26 of $4.8 million approximately. As required by federal requirements, at least 30% of funds are to be used for prevention and primary care services for children and 30% for children and youth with special health needs. All the programs, as we said, will be looking at flat funding from one fiscal year to the next. One of the things that this grant also supports is the Connecticut Maternal and Child Health Coalition, which includes over 180 individuals representing 97 different organizations and acts as a vital communications and networking hub among all the different providers that seek to improve maternal and child health outcomes throughout the state. The grant also supports the Reproductive Justice Alliance, which aims to expand and unify reproductive justice efforts across the state. Thank you for the opportunity to testify on these two grants, and now I'm available to answer any questions you may have.
Thank you very much, Commissioner. Are there any comments or questions? Representative Walker, do you have any comments? Representative Nuccio?
Thank you, Madam Chair. Just overall, in general, looking at the numbers here, flat funding year over year, where we have seen some reductions and increases, can you just validate whether or not these are reductions in services, or like the last presenter, are they things that we've completed and now the money's available for something else?
Sure. Do you have a specific block grant that you want to discuss first, or?
Well, if I look at the maternal,
Mhm.
right, there's no net change overall, but between the children and youth services and the maternal and child, there's the difference of the $63,000. I'm going to clarify it on the report that I'm looking at.
Yes.
So just that switch there for the maternal, and then the preventive, there really isn't, it's literally just flat funded across the, but if I hear you correctly, the preventive is really just administrative, what you guys are doing, you know, it's not necessarily programmatic. Whereas I think the maternal, there are more things in here that are programmatic than rather than just administrative.
So I'll clarify on both of those points. Thank you for that question. So in the first one, in the maternal and child health block grant, there was a specific, I think the reduction that you're looking at is roughly at the $20,000 that you see in that summary in the OFA report. So there was a one-time investment in doing a survey of children with sickle cell disease who are progressing to adulthood and how they were going to be able to manage that care. And so that one-time investment was for that survey to be conducted by UConn Health. And so that's why you see that there. It's now been put more into the programmatic support in the top half of the grant in the second fiscal year, and that's where that difference is coming from. Now, in terms of the preventative health services block grant, I do want to clarify, as I mentioned, more than half of that grant goes directly to our local health departments to provide programming at the local level to support local prevention efforts, specifically on chronic disease prevention. And that is particularly potentially vulnerable as we go forward. The president's budget eliminates this block grant, so we will have to address that if that so happens in the next federal fiscal year. But as of now, we are proposing that we will have level funding, which will mean the funding that the local health departments are expecting. I believe that there's also, between one federal fiscal year and the next, if you see in federal fiscal year 24, there was an additional $139,000 in the cancer prevention line. And that was extra funding that we received that we weren't expecting. And so in discussion with an advisory board that also helps advise this particular block grant, a decision was made to use those funds to help assess how women who experience early stage breast cancer are managing that challenge. And so that work was specifically funded to address that particular issue because we had an unexpected additional amount of money. Other than that, the other programmatic supports that we've talked about in regards to the public health services block grant are the same.
Okay. Well, I can tell you that, you know, we're not handling it great. That's just me. I'd like to go back quickly, just my last question on the maternal and child health. You know, you have a lot of focus in here on prenatal case management and the maternal delivery part of it. I know we've got other commissions that are looking at maternal health. And one of the things that I think was a horribly constructed bill was the birthing centers. Are we looking at anything with that? The reason I say that is, you know, my daughter literally had to help deliver a baby on the side of the highway a few weeks ago because we have no birthing services in the Northeast Quarter at all. So, you know, I think it's a fatally flawed bill and women are suffering for it. So with this maternal focus, is there anything in here to look at the policies that we passed around that maternal, that specific, you know, maternal issue that we're seeing, which is the lack of services in the rural parts of the state?
So this specific block grant does not have specific targeted funding that I think would address your specific question. However, as you know, in this last session, there was another bill passed where we would be working with OHS to be able to look at what are the barriers to developing those birth centers, what are some of the issues that are resulting in birth centers not opening. So within this block grant in and of itself, I would not say that there is a specific focus on that, but the perinatal case management, as an example, in areas where that type of funding is being provided can certainly help with some of that, but there's not specific funding within this block grant to address that issue.
So, okay.
So it would be fair to say that this block grant does not deal with the lack of maternal health, and we would talk about that in the regular session relative to what's going on in the northwestern, northeastern, and southeastern sections of the rural parts of the state.
Yes, that's correct.
Thank you.
That's good. I just wasn't sure if it was covered, anything was covered under that maternal section there. And I would just hope on a side note that, you know, you guys are taking a heavy hand with that because OHS allowed this to happen. So I'm hoping you guys can.
So we're not going to place blame on other agencies right now. Representative Nuccio, thank you. We're going to stick to the comments on the block grants that are in front of us.
I
So
hope you will be able to help with that.
we are going to stick to the comments on the block grants that are in front of us.
Thank you.
Representative Dillon. I know that, but we are sticking. Representative Dillon, are you?
Yes, ma'am. Thank you. Thank you very much, Commissioner, and good morning. Just this may have been covered, but I wonder if you could clarify the changes in sickle cell allocation and whether it affects the ability to detect the trait in people who may not know they have it.
So there's no changes to any of our newborn screening or other surveillance mechanisms. This one particular investment was only to specifically survey children that were growing up into adulthood and transitioning their sickle cell care from pediatric care to adult care. So there's no change in services as provided by this block grant. That was a one-time investment to help assess the challenges in that population.
Thank you. Follow up. I wonder, does that mean that what we learned from that has been translated into department policy, or does it appear somewhere else in this block grant?
The survey is still ongoing, so we do not have conclusive results yet to be able to implement policy changes.
Okay, thank you very much.
Thank you.
Thank
That's
you.
all.
Are there any other comments or questions for the commissioner? Commissioner, I have an off the, not relative to this block grant question for you, and I will ask you offline.
Thank you, Senator Austin.
I will not bring it up now.
I was on call.
Well, no, it has nothing to do with the block grant. So, Commissioner, if you wouldn't mind hanging around in case we have other questions that come up.
Thank you so much.
Up next is Commissioner Barton Reeves and team. Yeah. Okay, Commissioner, the floor is yours. The floor is yours, ma'am.
Yes, good morning. Just making sure I was using the right greeting. I was just looking at my watch.
Right numbers.
Yes, right numbers. Chairs Austin Walker, Gilchrist and Lesser, and ranking members Bethel, Nuccio, Seminary, and Case, and distinguished members of the Appropriations and Human Services Committee. I'm Andrea Barton Reeves. I'm the Commissioner for the Department of Social Services, and I thank you for the opportunity to present to you today our allocation plans for our Community Services Block Grant and our Social Services Block Grant. With me today is Deputy Commissioner Peter Hadler, who will also be here to answer questions. I will present the Community Services Block Grant. He will present the Social Services Block Grant, and then together, along with many of our team members who are here, and I keep saying this, there are other people working at DSS today, that we will answer the questions that you have. So starting with the Community Services Block Grant. Thank you, Sue. As a brief overview, our purpose is to support services and activities for individuals and families that are low income, specifically to address the causes of poverty. And we use a holistic approach. Many of our community action agency representatives are here today. Those services are focused on the ones that you see here on the screen, which include case management, energy assistance and weatherization, where you will hear from us later on this afternoon during our LIHEAP hearing, food and nutrition services, housing, and shelter. Next slide. Thank you. Specifically, our funding this year is estimated to be about $9.2 million. And pursuant to the appropriate federal statute, about 90% of those funds must be made available to the state and must be granted to the community action agencies. And there are 9 of those that cover 9 regions within the state of Connecticut. Accordingly, our plan actually proposes that we submit to you a plan to spend $8.3 million of those dollars. And you'll see the plan is actually on the next slide, and that each of them will, I'm sorry, not yet, Sue. Not yet, Sue, right. Each of those amounts align with an allocation plan that we came to an agreement with our community action agencies. And so just as a bit of history, previous to our alignment with our community action agencies, portions of these funds went to them, and they also went to the trade association known as CAFCA. We did get some direction from the federal government that the appropriations to CAFCA would no longer be permitted, and that a new appropriation plan would have to, allocation plan would have to be negotiated with our community action agencies. We did in fact accomplish that goal with a year of bridge funding to our community action agencies that were adversely affected by some of the changes that we needed to make to the plan that were federally mandated. And then this year, what you'll see in front of you, as it was last year, are those plans that no longer include that bridge, but also that now actually reflect the allocation plan as it was agreed upon. Again, that plan supposes that we will spend about $10.3 million, including some carry forward. The carry forward is being allocated to cost of living allocations for our community action agencies. Okay, now we're ready for the next slide. Generally, as I mentioned earlier, we will be proposing to allocate $9.4 million to our community action agencies. CAFCA will get about $461 million. I'm sorry, I'm sure they wish they did, for $461,000 for appropriate uses that are allowed under the federal statute. And then the exact amount will be withheld by the agency, by us, by DSS, as a small administrative cost for the people who actually administer and oversee the plan for the community action agencies, for a total of about $10.3 million. Next slide. This slide really offers a pictorial of how those funds will be allocated. And you can see that the larger organizations include Community Renewal Team, our Community Action Agency of Western Connecticut, followed by the Community Action Agency of New Haven. And close behind them is the Alliance for Community Empowerment, normally known as ACER, the Alliance. The others are there for you to see. This is just one way in which we can portray the way in which the funds are allocated, but on the next slide is actually the chart. So you can see what the allocations are for FY 2025 and are proposed for FY 2026. And again, as I had explained earlier, we are sticking with the allocation plan that was negotiated with our community action agencies. There is one exception that you will see here, and that is ACE, that second line, the Alliance for Community Empowerment. They are not actually receiving a reduction. This has to do with the timing of some expenses that they submitted, so that we ended up paying those in 2025, and then you see the concomitant reduction in 2026, but and overall they're receiving the actual same allocation. We spoke earlier of the administrative costs and the discretionary programs, which brings us to the $10.3 million that you see in the far right column. And that ends the summary of the allocation plan for the community block grants. And I will now turn it over to Deputy Commissioner Hadler to run through the social services block grant.
Thank you, Commissioner, and good morning, Senators and Representatives. I'm happy to give a quick overview of the social services block grant and the categories where we are projecting funding for the upcoming year. So very broadly speaking, as a little bit of background on SSBG, SSBG has a purpose of helping people to achieve economic self-sufficiency, prevent or remedy neglect, abuse, or exploitation of vulnerable groups, and helping to reduce inappropriate institutionalization. So you'll see a lot of services to help support people to live where they are or to be able to move out from homeless shelters into more stable housing funded through SSBG. There's a particular target on vulnerable persons or families for those who are less able to care for themselves, in particular individuals with disabilities, youth and older adults. And in Connecticut, we fund 11 categories of services. There's 29 permitted categories under the federal statute that establishes SSBG. We fund 11 of those categories here in Connecticut. I'm not going to read them all off. You'll see them both here on this slide and in a subsequent breakdown and another pie chart in just a moment. Broadly speaking, the income eligibility for the population that is served by SSBG is 150% of the federal poverty guidelines, which is approximately $48,000 for a family of 4. The exceptions are the Fatherhood Initiative and home delivered meals, for which there is not an income cap. So we are projecting SSBG funding to be level from last year's allocation, which comes out to about $17.2 million. We are proposing to expend slightly more than that, 19.2, and that is because we are using our carry forward funds to help provide COLAs that have been instituted over the past several years. We are continuing to use our carry forward funding to ensure the providers are able to receive those COLAs. Next slide, please. So here you can see a breakdown of the service categories where SSBG funds are allocated. We provide funding directly to providers. We offer some services directly through DSS ourselves, and our sister state agencies also receive a significant portion of the funding. The details about all of those allocations by agency and the like are built into the actual allocation plan itself. We're focusing right here on the categories of funding. And for example, the largest category that you see in front of you is independent and transitional living services. A very significant amount of that is targeted towards the homeless shelter network here in the state. And I just want to quickly walk through the differences between last year's estimated dollar areas and this. We have some minor adjustments from where it's being allocated. You'll see in the first line an approximate reduction of 7%. This is pertaining to a $200,000 temporary allocation that was provided to the Department of Housing. They had received additional funding during the pandemic, and this is being used to bridge back to a baseline funding level for them out of SSBG. In the home-based services line, you'll see a slight increase. This is actually putting us at the same level that we had proposed last year. There was a slight bit of underspend in this category. The same is true for protective services for adults. And this is mostly due to the timing of expenditures, as you've heard in some of those other some of the other presentations. Sometimes we have bills that land on one side or another of a fiscal year, and so you'll see slightly higher or lower numbers, and that is the case for those two categories. We are also reducing the home delivered meals line item that was a temporary funding that was used to help to support that line, but where federal funding under the Older Americans Act had been decreased. So we used SSBG as a temporary bridge to help adjust back to a normal baseline for SSBG funding for that particular service category. And those are the changes. And again, you'll see a slight overall increase in the net dollars we're proposing to spend, and that relates back to that COLA that is being provided across the board. Any questions?
Thank you. Commissioner, I noticed on the block grant on community services that Thames Valley Council for Community Action had a decrease of close to $30,000. Was that also an invoice relative to the same thing as the ACE one?
Yes, it is.
Thank
It's a
you. So
timing.
it's not a decrease for TVCCA, it's just a decrease in the invoice
Yes, it's
amount.
about timing.
Thank you for that. Are there any other comments or questions? Representative Nuccio.
Thank you, Madam Chair. So I just have one question I was hoping you can kind of give us a little bit more detail on. I've heard this now twice, and I didn't ask Commissioner Tristani, but also you mentioned that you're using part of the carryover for the COLAs to the providers. Can you talk a little bit about that? Because it seems to me carryover is kind of like one-time funding, right? Like it's not going to be there forever. So how does this impact the funding going forward if you're increasing the COLAs with carry forward and not with programmatic dollars?
Yeah. It is an excellent question, Representative. This is one-time funding, and our providers do understand that. We are leaving it up to them to determine how they may continue with those COLAs. At this point, they do know that the one-time funding is finite. I don't really have a much better answer for you than that, except that we really are trying to provide them with as much information as we can. So with as many dollars as we can. So they are, in fact, cost of living increases. We do understand that there are ways in which they can pay those cost of living increases. They can be in the form of one time. They can continue. We don't dictate to our community action agencies how they will use those dollars, and if they want to use them in ways that provide a one-time increase or over time, then that's up to their discretion. But there's definitely a risk in using one-time funding for COLAs. There's no question about that.
Okay, so if I hear you correctly, then we're providing this one-time funding, but they have full understanding that it is one-time funding. So if they come before us next year and say you're reducing us because of it, this is not, I feel like we've had this conversation 8 million times since
Yes.
2020, but it
Yes.
is truly one-time funding, and they will have to figure out how to sustain the COLAs going forward.
They would have to do that, yes.
Okay, thank you very much.
Representative Comey.
Thank you so much, Commissioner. Are any of these dollars allocated through call centers or any of those those types of services?
So the call centers would be more applicable to our LIHEAP program as opposed to our our community action agencies. But we do have some hotlines, and go ahead.
Yeah, no, absolutely. It's a great question. And I think what's important to understand, right, as the commissioner was alluding to, LIHEAP has a major operational component. CSBG is also used to help provide administrative funding for the community action agencies. So it is possible that the staff that are hired using CSBG funding are also working on the phones to provide services.
Okay, thank you. Thank you, Madam Chair.
Senator Anwar.
Thank you, Madam Chair. Thank you, commissioners, for your testimony. This home food delivery, can we expand a little bit on this? Because 1,900 some people are getting this at home. The number of people who are going to need this is increasing. It's preventing people from being institutionalized or being in nursing homes or long-term facilities. But we are reducing the fund. What's the challenge here?
I apologize. The challenge there, Senator, is that we are actually realigning the funding to the pre-pandemic dollars. So this is supposed to be one-time funding to sort of smooth the gap that had existed prior to that. And we are now returning those dollars back to where they were before. We completely understand and appreciate that that means that there would be a reduction in the numbers of meals that we would be able to serve. But we really don't have any other resources at this point, given our proposed allocation plan that we could substitute that for. So we did have to make the decision to move that back to the pre-pandemic dollars as we have. I know I keep referring to LIHEAP, but we did have to do that when we did not have any more additional temporary funding for specific line items.
This is going to lead to some people moving towards assisted living or other facilities and not be able to live independently. So perhaps this is a gap that we will have to fill one way or the other, perhaps in the upcoming session. But thank you for highlighting this. Thank you.
Representative Hughes.
Thank you, Madam Chair, and thank you, Commissioner and Deputy Hadler. Can you explain for us and our colleagues the protective services for adults, how much of this block grant helps to is allocated for the reporting helpline for protective services to prevent elder abuse?
Thank you, Representative Hughes. I don't have the specific breakdown of how the funds are used within that particular category. They are used fairly broadly to help support our operations. I'm going to call up our Director of Social Work Services, who can help provide us a little bit more information, unless you guys want to put a pause.
Excuse me. I'm sorry. Would you be prepared to say that the Protective Services Hotline is not just funded by a block grant, which is only a small fraction of what your spending is? Is that not a fair assessment on what is going on here? And the small dollars that are in this block grant, what is your budget in DSS broadly? What's your total budget in DSS?
Our total budget is about $12 billion.
Okay.
Yeah.
And so this is a smaller portion thereof, and because I completely agree with Representative Hughes that we have to have hotlines for elder abuse. It's something that's really important, but their total budget is not covered by this block grant.
That's correct.
No, it is not.
And
I just wanted to make sure that was secure. Thank you. Thank you. You answered my question.
Thank you, Representative Hughes. Representative Dathan.
Senator, I'm sorry, when I have a moment, may I return to Senator Anwar's question? I did get some
Yes,
clarification.
go ahead. Go ahead,
Thank you.
Commissioner.
All right.
Representative
Maybe it
Dathan,
was
hold on for a
Representative
minute.
Nuccio's question. I apologize. So Representative Nuccio, it turns out that I was incorrect and I stand corrected regarding the COLAs. So the plan was, and thank you to OPM for reminding me of this, is that the COLAs are funded. What we are doing is funding the COLAs with our carryover first. And then when the carryover is exhausted, then they will be covered under our current services within our budget.
Okay, so
Okay.
we do have it.
We do have it. Yes.
So
Thank
this
you.
is just, it's giving you a little more, sorry,
Giving us a little more runway.
it's giving you a little more runway. It's giving you a little more wiggle room in your $12 billion budget because you don't have to provide the COLAs from there. You're doing it from here.
That's correct.
Okay,
Right.
thank you very much.
Thank you. Thank you, Senator.
Thank you, Commissioner. Representative Dathan.
Thank you so much, Madam Chair, and thank you, Commissioner, again, for all your work here. I'm going to have a quick follow-on from the transitional living services and independent services. Is this helping with, some of the focus on getting those COLAs adjusted? Is this helping alleviate and ameliorate the wait lists that we have for people that are in need for services?
There is not a direct correlation between these grants and the wait list. This is
Okay.
for our community action agencies.
Okay, great. And so how many community action agencies are involved here?
There are 9.
9. Okay, great. I will follow up with any questions later, but this is helpful. Thank you, Madam Chair.
Thank you. Representative Dathan, just so you know, on page 11 of the OFA, it lists all the community action agencies. So that you can.
Yeah, I thought I saw that, but I wasn't 100% sure which ones we were talking about in
That
relation.
includes all of them in the whole state.
Okay, great. Thank you.
Thank you. Are there any other comments or questions for the commissioner? So, Commissioner, thank you very much. We're going to end the agency portion, but we're going to the public portion. And so if all agency heads wouldn't mind staying around until we finish that piece of it, that would be very helpful. We have Rhonda Evans from the Community Association for Community Action Executive Director. Ma'am, the floor is yours. We have 3. We have 2 listed on here and 1. We still have trouble.
Good morning, distinguished chairpersons, vice chairs, ranking members, and members of Appropriations, Human Services, and Public Health Committees. Thank you for holding this public hearing on the federal fiscal year 26 Community Services Block Grant and the Social Services Block Grant allocation plans. My name is Rhonda Evans, and I'm the Executive Director of the Connecticut Association for Community Action, the statewide association that represents Connecticut's 9 community action agencies. These agencies are the state and federally designated anti-poverty agencies, and last year served over 247,000 low-income individuals and families, low-income individuals, covering each of Connecticut's 169 cities and towns. CAFCA strongly supports the Department of Social Services fiscal year CSBG allocation plan, which provides base funding for Connecticut CAAs. CSBG is the foundation of our network's ability to deliver critical services and programs to individuals and families in need. For 6 decades, CAAs have been trusted in their communities to respond swiftly and effectively to economic hardship, housing insecurity, food access, unemployment, and other crises. CSBG makes this possible by supporting a flexible, customer-centered, and locally driven service delivery system. CSBG is not just a safety net. It's an engine for community resilience and mobility. Agency used the dollars to conduct community needs assessments, support program development, strengthen partners, and other things. These funds also help leverage millions of dollars in federal, state, and private funding each year. However, we are concerned about the continued uncertainty at the federal level, and we ask that any disruption and reduction in CSBG funding would threaten vital services across Connecticut. Therefore, we're also respectfully urging the state to engage in contingency planning to ensure uninterrupted support for those most in need if there are any changes in the federal allocation for these dollars. CAFA also supports the SSB allocation plan, and in particular, the continuation of the SSBG case management program. This year marks a decade of successful statewide administration of this program by CAFCA and the CAAs in partnership with DSS. SSBG case management provides holistic, individualized case management to Connecticut's most vulnerable populations, including underemployed adults, those facing housing instability, individuals with disabilities, and those needing mental health or recovery services. From October 2024 through June 2025, the CAAs provided more than 11,000 services to nearly 3,000 eligible individuals and families. The program works, it's intensive and targeted and designed for sustainable outcomes. SSBG is also party to possible threats on the federal level, and we can also urge the state of Connecticut to consider contingency planning in the event of cuts to that funding as well. Thank you so much for the opportunity to testify.
Thank you very much. Appreciate your comments. We're all set.
Thank you.
Up next is Emma King. Is Emma King here?
Good morning, everybody. Hi, how are you?
Good, how are you?
I'm good. So good morning, Chairwoman Austin, Chairwoman Walker, and members of all of our committees. I'm joining you today from Danielson, Connecticut. So if you are jumping out of airplanes, I hope it's in Danielson.
It's in Ellington.
Oh, come on. Well, you should also, then you should compare it because we have a wonderful company here in Danielson, and I can see you guys jump from my house. Anyway.
Okay.
My name is Emma King, and I serve as the Executive Director for Access Community Action Agency, which operates in Willimantic and Danielson, and we serve residents across the communities in Windham and Talon County. As a federally and state designated anti-poverty agency, Access is uniquely positioned to operate within a rigorous accountability framework while remaining responsive to the evolving community needs of Northeastern Connecticut. And a core reason we are able to do this so effectively is because of the Community Service Block Grant and the allocation plan presented by our partners at the Department of Social Services. You've already heard from several speakers today about the critical role of federal HHS block grants in delivering services to our state's most vulnerable. I'd like to offer a few unique examples of how CSBG enables Access to deliver high-impact community-based programming to over 17,000 individuals and 8,000 households in Windham and Talon County. Access uses CSBG funding to support and operate mobile and site-based food pantries. Our mobile pantry, which is a wonderful van that we received in partnership with FoodShare, visits 19 unique locations across our service region each month, ensuring food access in rural and underserved areas. Between January 1st and March 31st of this year, we provided 9,000 meals to over 508 unduplicated individuals through our mobile pantry alone. Additionally, with support from CSBG and the Connecticut Department of Housing, Access has operated a 20-bed cold weather emergency shelter during the winter months since 2019. This effort began after hearing from several municipalities about the urgent need for emergency winter shelter. In partnership with a local church in Danielson, we launched a no-freeze shelter and since then have provided safe, warm accommodations each winter. Last season, we served 75 unduplicated individuals, many of which had no option for alternative safe shelter. Additionally, CSBG has supported our efforts in the region to increase and preserve affordable housing for low-income seniors and the disabled. Access has developed over 100 units of HUD and low-income housing tax credit supported senior housing, and we are in the final stages of acquiring and rehabilitating a 96-unit USDA rural development and HUD supported complex for seniors and individuals with disabilities in Brooklyn, Connecticut. This project has been years in the making. After assuming management of the property 7 years ago, we've worked to stabilize operations and bring the facility to best practice. We look forward to the transfer of ownership of this project in the fall and preserving these units so that we can have high quality, affordable housing for decades to come. Most recently, Access, again in supported by CSBG, has opened the Housing Education and Counseling Center in Danielson to expand access to in-person homebuyer education in the Northeast corner. In partnership with our local chamber and Habitat for Humanity, we have staff who are in process of receiving HUD certification and offering one-on-one counseling and group workshops to support
You're
families.
almost done? You're-
Yes, with their home ownership journey. Each of these examples illustrates how Access leverages CSBG funding to respond to real needs with real solutions in real time. Just as importantly, we do so in close partnership with our community and with full accountability to the Connecticut Department of Social Services. Every dollar is tracked, measured, and reported as part of the state's annual CSBG report. Access would like to thank Cassandra Norfolk Johnson, Claire Fravel, and the entire DSS team for all their support, guidance, and partnership. I want to thank you again for the opportunity today. And we are incredibly grateful for Connecticut's commitment to supported CSBG funding organizations. We look forward to continuing this work and finding new creative solutions to our community's most pressing challenges. Thank you.
Thank you, Emma. You're all set. Up next is Leslie Wolfgang. Is Leslie here? Leslie, you'll notice Leslie's not on the list, but she is on the list. When we printed out the list, it left her name off, and the administrator said that she actually signed up before the 3 o'clock deadline. There were a couple of people that signed up after the 3 o'clock deadline that are not on this list, but she is on the list because she did sign up. Thank you. As long as everybody's checking everybody here, they're all set.
Thank you. I am testifying today against the inclusion of Planned Parenthood of Southern New England in the block grant allocation plan for 2026. Planned Parenthood should not receive these funds for a few different reasons. Obviously, as a representative from the Family Institute of Connecticut, I am concerned about the killing of unborn children. There is nothing more important than a child. An abortion in Connecticut disproportionately affects Black and Hispanic families. Black and Hispanic people account for 57% of abortions in Connecticut, but only accounted for 19% of the overall population. That would be reason enough to refuse funding. But Planned Parenthood of Southern New England doesn't need our money. According to their 2023 990 filing, they have an endowment of $49.5 million, a public charity with almost $50 million in the bank. 95% of that endowment is unrestricted and can be used for the services set forth in the grant. This block grant proposal gives an additional $1,424,000 to Planned Parenthood. They have already received $6.3 million through this legislature in the past 12 months, including $3 million of emergency COVID funds that should have been used or could have been used to reduce electric rates, not pad Planned Parenthood's bottom line. And are they even doing a good job in Connecticut? A New York Times article exposed poor care, including botched abortions and more. Connecticut is making choices among a variety of issues and nonprofits, and we should not be funding Planned Parenthood again when they have so much more than others. Thank you.
Thank you. You're all set. Appreciate it.
Thank you.
So we are, Madam Administrator, I don't believe there's anybody else on our list for, we're going to close the public hearing component of this, and we're going to go on to the meeting agenda. We're going to give about 5 minutes to sort of reestablish where we are. And we'll start when we go to that point with public health, and then go to human services, and then go to appropriations. And I would remind everybody that when you're calling out for your motions, please include the name of the block grants that you are respectively voting on, and make sure that the community mental health services says with the technical corrections. So we got 5 minutes to get established. 12:10. We'll be back. Because we are doing all of them. Oh, you're the best. Look at you. It's so bad for me, but it's so good. Right? Listen, I couldn't live life at her top. It's just not worth living. Yeah, like I just, I think that women have certain issues that we have to deal with as we get older, and weight gain comes along with that, and especially for breast cancer.
Would you please turn
Excuse
off?
me, please turn off the mic.
Have we ever seen their acting?
So good afternoon. We're now past 12 o'clock and we're going to go on to the voting component of the first 6 block grants. And so if everybody could take their seats, and agency people, you're free to leave if you would like to leave. You don't have to stay. And I would remind everybody that these votes are not left open. So if you have colleagues who are not here and you do not see them online, please let them know that we are going into voting, and each of the clerks will ask at the end of their roll calls, is there anybody else that needs to vote, so that anybody that pops on, that gets them done. So please make sure everybody knows votes are not left open. We do not leave votes open on block grants. So we are calling our committee meeting to order, and I'm going to turn this over to
Senator
you. Public health first?
Yes.
Is it you, Senator Anwar?
Yes, correct.
Senator Anwar, the floor is yours.
Thank you, Madam Chair. Good afternoon, everyone. We will call the Public Health Committee meeting to order. Our first item on the agenda is to entertain a motion to approve the following federal fiscal year 2026 block grant allocation plans: maternal and child health services and preventive health and health services. Next is substance abuse prevention, treatment and recovery services. Next is community mental health services with the technical corrections. Is there a motion?
So moved.
Motion has been moved by Representative Kristen McCarthy-Vahey. Is there a second?
Second.
Second by Representative Mara. With that, any questions, comments? Seeing none, Mr. Clerk, right out of the GQ magazine this morning and afternoon.
Just following you, Senator.
Call the vote.
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy-Vahey,
Yes.
Representative Belton.
Yes.
Can you do that one more time, Representative? I didn't see you.
Representative Belton votes yes.
Thank you. Senator Marks?
Senator Marks votes yes.
I don't see you on
I
camera.
know. Sorry.
Okay.
Senator Marks votes yes.
Thank you. Senator McCrory?
Is a yes. I'm sorry. McCory's a yes.
Okay, thank you. Senator Summers? Representative Claritas Detria?
Representative Claritas Petria votes yes.
Representative Berger Givallo?
Rep. Berger Givallo votes yes.
Representative Biggins?
Biggins votes yes.
Representative Carpino?
Representative Carpino votes yes.
Representative Dauphiné? Representative D'Amico?
D'Amico votes yes.
Representative Elliott? Representative Jenga?
Representative Jenga votes yes.
Representative Gilchrist? Senator Gordon?
Senator Gordon votes yes.
Senator Hockadell?
Senator Hockadell votes yes.
Representative Cavros DeGraw?
Cavros DeGraw votes yes.
Representative Kitt?
Representative Kitt votes yes.
Representative Kennedy?
Kennedy votes yes.
Was that on cam? I didn't see you, sorry. Oh, yeah, we didn't.
Kennedy votes yes.
All right, thank you.
Thank you.
Senator Kushner?
Senator Kushner votes yes.
Ooh, oh, there we go. Representative Mara? Yeah, we saw you.
Mara votes yes.
Thank you. Representative Martinez?
Representative Martinez votes yes.
Representative Morin Bello?
Morin Bello votes yes.
Representative Parker? Representative Pauletta? Senator Rahman? Representative Reddington Hughes?
Reddington Hughes votes yes.
Representative Romano? Representative Ryan?
Votes yes.
Senator Slatt,
Senator Slatt votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Representative Zupkis,
Oh, I'm going to miss my committee.
and I'll go through the list again. Senator Summers,
Yes.
thank you. Representative Dauphiné, Representative Elliott, Representative Gilchrist, Representative Parker, Representative Paletta,
Yes.
Senator Rahman, Representative Romano, and Representative Zupkis.
Oh, Mr. Clerk, can we have the tally, please?
Mr. Chair. We have 26 voting yay, 0 nay, 7 abstaining, or sorry, no, 0 abstaining, 7 absent not voting, and yeah, that's it. Thank you.
Thank you. Public Health Committee will be in recess. Thank you, Madam Chair.
Recess.
Hello, good afternoon. The Human Services Committee is convened. Is there a motion to approve the fiscal year 26 block grant allocation plans for community mental health services with the technical corrections, social services, and community services?
So moved, Representative Dathan?
Second.
Is it second? First, Representative Dathan, second, Senator Anwar. All in favor? Okay, okay.
Children.
Okay, so Madam Clerk, can you please call the roll?
Representative Gilchrist. Senator Lesser.
Senator Lesser, aye.
Representative Case.
Representative Case votes yes.
Senator Perillo.
Perillo votes yes.
Representative Comey.
Representative Comey votes yes.
Senator Marr.
Senator Marr votes yes.
Senator Anwar.
Senator Anwar votes yes.
Representative Butler.
Representative Butler votes yes.
Representative Dathan.
Representative Dathan votes yes.
Representative D'Amico.
D'Amico votes yes.
Representative Fortier.
Representative Fortier votes yes.
One second.
Senator Gaston. Representative Hughes.
Representative Hughes votes yes.
Representative Johnson.
Representative Johnson votes yes.
Representative Kitt.
Representative Kitt votes yes.
Representative Master Francesco. Representative Meskers.
Representative Meskers votes yes.
Representative Pizzuto.
Representative Pizzuto votes yes.
Representative Santiago.
Santiago votes yes.
Representative Scott.
Representative Scott votes yes.
Representative Shake. Yes. Representative Stewart. Representative Vale. Are there any other members that wish to cast their vote?
There are a couple of people that just received a text that they're having difficulty joining, so give us less than 10 seconds.
Okay.
Sorry.
Hi, Senator Rahman here. I don't know I missed the vote.
Senator Rahman, the Public Health Committee has already voted.
Oh, okay.
But if you're on appropriations, you should Okay, okay. Thank you. Yes, we can put a note that you came on late, so thank you for letting us know.
Thank you.
Are we all set, Senator? Okay. Can we have a tally, please, Madam Clerk?
The tally is 18 yay, 5 absent.
Okay, thank you. And the Human Services will recess the meeting.
Good afternoon, everybody. I'm gonna convene the meeting for the appropriations. The chair convenes the meeting for the Appropriations Committee. I'm asking for a motion to approve the following FFY 26 block grant allocation plans: maternal and child health services, preventive health and health services, substance abuse prevention, treatment and recovery services, community mental health services with the technical corrections, social services and community services. Is there a motion?
So moved.
Moved by
Second, Valinsky.
Representative Walker, seconded by Representative Nuccio. Is there any discussion? Seeing no discussion, Madam Administrator, could you call the roll, please?
Senator Austin.
Senator Austin votes in the affirmative.
Representative Walker.
Representative Walker votes yes.
Senator Hartley. Senator Kushner.
Senator Kushner votes yes.
I see Senator Hartley. Thank you, Senator Kushner. I have you. Senator Hartley.
In the affirmative. Thank you, Madam.
Thank you, ma'am. Representative Exum. Representative Paris. Senator
Harris votes yes.
Thank you. I need to see you, sir.
Harris votes yes. Paris votes yes.
Keep trying.
Paris, I'm on. Paris votes yes.
All right. Up.
Did you? Paris votes yes.
Yay!
There we are. Thank you.
Senator Summers.
Yes,
I need to see you, ma'am.
I'm right here.
Hi. Thank you.
Yes, thank you.
Nuccio. Representative Ackert.
Representative Acker votes yes.
Senator Anwar.
Senator Anwar votes yes.
Representative Baker.
Representative Baker votes yes.
Representative Belton.
Representative Belton votes yes.
Senator Berthel.
Good afternoon, Madam Administrator. I think I'm frozen. Can you see me?
I can hear you, but I can't see you.
All right, let me log back out and come back in. I'll be back.
Great. I'll come back to you.
Thank you, ma'am.
Thank you. Representative Belinsky.
Representative Belinsky votes yay, Madam Administrator.
Thank you, sir. Representative Brown. No marking. Representative Candelaria. Representative Corpus. Rep Corpus votes yes. Dathan.
Representative Dathan votes yes.
Representative DiCaprio.
Representative DiCaprio votes yes.
Representative DeFranco.
DeFranco, yes.
Representative Delaney.
Delaney votes yes.
Representative Dillon.
Representative Dillon votes yes.
Representative Felipe. Senator Flexer.
Oh, hold on, ma'am. Just trying.
Okay.
Representative Felipe votes yes. Sorry about
Thank
that.
you. Gotcha. Senator Flexer. Representative Fonsello.
Senator Fonsello votes yes.
Representative Garibay.
Garibay votes yes.
Representative Gibson.
Representative Gibson votes yes.
Representative Gilchrist. Representative Gonzalez. Senator Gordon.
Senator Gordon votes yes.
Representative Haddad. Senator Harding. Representative Hoxa. Representative Johnson.
Representative Johnson votes yes.
Representative DeGraw.
Kavros DeGraw votes yes again.
Representative Kennedy.
There I am. I can't. Kennedy votes yes.
Thank you, ma'am.
Thank you.
Representative Khan. Representative Leeper. Senator Lesser.
Senator Lesser, aye.
Representative Martinez. Representative Martinez. We know you're on.
Representative Martinez votes yes.
Great. Thank you, ma'am. Senator Marks.
Marks votes yes.
Representative McCarthy Vahey.
Yes.
Senator McCrory.
McCrory's a yes.
Thank you, sir.
All right.
Representative Nolan.
Hello, Susan. Hope you're doing good. I'm a
Thank
yes.
Thank you. Representative Pavlak D'Amato. Representative Reyes. Representative Rosario.
Rosario in the affirmative.
Thank you, sir. Representative Ryan.
Yes.
Representative Manny Sanchez. Representative James Sanchez.
Representative James Sanchez votes yes.
Representative Sims.
Representative Sims in the affirmative.
Senator Slapp.
Senator Slapp votes yes.
Senator Winfield.
Senator Winfield in the affirmative.
Thank you, sir. Are there any members of the Appropriations Committee who have not yet cast their votes who would like to do so at this time?
Rep Exum votes yes.
Hello,
Good
Rep
afternoon.
Exum. Thank you
Hello,
very
good
much.
afternoon. Thank
Anyone
you.
else?
Rep Brown votes yes.
Thank you, sir.
Thank you.
Madam Administrator, I'm still having trouble with a visual, but I would vote yes if you could see me.
Madam Administrator, this is Senator Gaston, votes yes.
Okay.
We can,
Madam Administrator, pardon me, Madam Chair, I'm back. Senator Verthel votes in the affirmative. Thank you.
Madam Administrator, Senator Flexer votes yes.
Thank you, ma'am. Anyone else? Representative Pavlak D'Amato?
all set, Madam Administrator.
I am, Madam Chair.
And the tally is?
Total number voting 42, those voting yea 42, those voting nay 0, those abstaining 0, those absent not voting 11.
Motion passes. Madam Administrator, there were 2 senators that came on for 2 other committees. In the minutes, would you include Senator Rahman came on too late for his vote, and Senator Gaston came on too late in his committee for the votes, please?
So if my colleagues would so note.
Thank
yes.
you, very much appreciate it. So the Appropriations Committee has passed the motion, and I would entertain a motion to adjourn. Moved by Representative Foncello, second
Second,
by
Representative Nathan.
McCarthy Vahey. All All those in favor of adjourning and appropriations indicate by saying aye.
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 No opposition, no abstentions, motion carries. We are adjourning on these 6 block grants.
Thank you. This is, we'll reconvene the Public Health Committee and we will entertain a motion to adjourn. Is there a motion? Representative Kristen McCarthy, where he moves. Is there a second? Anyone? Representative Mara, thank you. Seeing no comments or questions, all those in favor say aye. Aye. Okay, we stand adjourned. Thank you.
At this moment, I'd like to reconvene the Human Services Committee. I'd like a motion to adjourn.
So moved, Representative Dathan.
Thank you. Representative Dathan, can I have a second?
Is there anybody on public health here?
Human-
Human
Second,
Services.
Sarah Kit.
Yeah.
Thank you, Representative Kit. Any comments or questions? Seeing none, I adjourn the meeting. Thank you very much.
So, Madam Administrator, we have another meeting coming up. If you could tell us what time we have to be back?
Yes, I look forward to seeing the members of the Appropriations and Human Services Committees back here and on Zoom at 1 p.m. to consider
Is
the.
Energy on then too?
But they're not in the room though.
Yeah.
Yes, Energy will be joining us
Okay, great.
to do the LIHEAP plan.
Thank you. See you all soon.
Thank you.
I'll put a.
Holy shit.
Please mute the mics. Please mute the mics. Mute.
Hello, Representative Walker. We've adjourned the meeting. We'll be back at 1.
Okay, now I just want to mute the mics. People aren't muting the mics and I can hear conversations, so please tell everybody. Thank you.